is the video competency for crutch teaching. This competency is step 1, like all the others, say to do a medical aseptic hand wash and to gather your equipment. So you will go to the other room, do a hand wash, and the equipment you need to gather for this competency is a set of crutches. The crutches are adjustable very similarly to the quad cane and the walker. There is a push button so you can adjust it for patients' approximate height prior to, and we'll talk about how to fit the patient for crutches specifically in just a moment. So step 2 then says to identify the patient and explain the procedure. So I'm going to call my patient in, Erin Woods. Hey Erin, how are you?
Good.
Good, I'm going to have you have a seat here. Your ankle bothering you? All right. What we're going to do today is we're going to go ahead and get some crutches fit for you, okay, to kind of help you get around with that ankle. All right. Can I get your birthday before we get started?
April 10th, 03.
Okay, perfect. That's what I have in your chart too. So what we're going to do next is I'm going to go ahead and have you stand up so I can adjust these for your height. All right. So what we're going to do to adjust crutches for the patient's height is that the top of the crutch is not where the patient's going to put their weight, okay? They're going to put all their weight on their hands, and we need to tell them that. The top of the crutch should be about 2 to 3 finger space underneath their armpit, about 2 inches under that armpit. So let's see how these fit for you, Erin. Okay, all right, that looks good. Let's check this one. All right, let me know if they bother your armpit. They might be a little bit high, but we'll see how things go. Now what I want you to do is we want to make sure that the patient's elbows are bent at a between 15 and 30 degree angle. So somewhere around a 20-degree angle, and these look pretty good because again, we want her weight on her hands, not her armpit. If she puts that weight on her armpits, it can cause problems with circulation, nerve damage, etc. Okay? All right, Erin, does that feel comfortable for your weight to be put on your hands? Okay. So now I want to give her a little bit of instruction now that I have the crutches adjusted to this particular patient. I want to tell her exactly what to do, how to go forward, where to put her weight, etc. All right, Erin, so the first thing that I want you to do, and I don't want you to move them yet, but I'm going to have you move the crutches forward about 6 inches, and then you're going to keep your bad ankle held up. And with your good ankle, then you're going to swing to even with the crutches, okay? So just little baby steps at a time. So go ahead and then swing right to. There you go. Very good. Excellent. All right, stop. All right, so we want to watch the patient, see if they have any questions, see if things feel comfortable. We want to watch to make sure they're putting that weight here and not in the armpit. All right, Erin, we're going to go ahead and turn around. Now I'm going to have you go back to your seat. Doing good. All right, you can go ahead and have a seat, Erin. I'm going to set these aside for just a second, and then I'm going to ask my patient if they have any questions, okay, about what they did, give them some feedback on the observation that I did on them using the crutches, and then I'm going to let them go. So, Erin, did that feel comfortable, okay? Do you think this will be better than hopping around? Okay, sounds good. So, Erin, you can go ahead and go. I'm going to go ahead and give you these crutches now that you know how to use them, and you are done with the doctor for today. Okay, so the last thing that I need to do is I've discharged my patient. I'm going to wash my hands and do my documentation. Documentation is going to be very similar to what we did for the cane and walker. So I'm going to do my patient's name and date of birth at the top, date, time, instructed patient on how to use axillary crutches, because remember there's several types of crutches, and that's what we did was axillary. Instructed patient on how to use axillary crutches, and then just sign it, and that's all that is required for documentation.